Yes, medical colleges means academic institutes, right? Academic institutes. There are separate business format, separate licensing requirement, and separate infrastructure need. So, academic institutes in healthcare, they have a separate, a specific role in the industry. Basically, every sector has a significant role. They are contributing in healthcare economics different way. For example, healthcare academic institutes, they are contributing for the talent supply, skill and training development, research in the any kind of academics, right? Every industry need that academic sector to grow that industry, right? But that academic institute, right? But academic institute sector, it doesn't mean that there must be some institute or university should be there. There can be a small skill center. They are providing basic training for the healthcare professors. They comes under academic institutes only. That's a sector. So I mean, overall, there are pharmaceutical training institutes, there are nursing institutes, there are medical, dental, physiotherapy institutes, there are skill training centers, all comes under academic institutes. Transport, but hospital, it's a hospital service, right? Clinical trials, yes, means the research organizations, right? Research organization, you can say CRO, they have different business model. You require licensing, and the infrastructure is different. Medical tourism. Okay. Let us check. Do we consider medical tourism as a separate sector? Why not? You can answer any. Don't worry.
Medical tourism is a part of hospital industry, clinics.
Okay, that's part of a hospital service. So, medical tourism we cannot consider as a separate sector in the healthcare industry. It's a part of hospital service, because for medical tourism, anyways, you are attending international patient rather than your in-house, your regional or your citizens. The international patients travel for the treatment, but ultimately they got a treatment at hospital or clinic setups, right? Telemedicine, yes. We will call it digital health. Digital health, wherein there are, as you said, telemedicine, telehealth, or you order online laboratory test, you order online pharmacy, you do online consultation or a telemedicine or a telehealth. There are different keywords, but it considered digital health as a separate sector. Let's pause here. Now, what is the difference between healthcare IT, tech, and digital health? Why both are different sectors? Anyone? Any thoughts? Any stupid thoughts? You can speak up, no problem. Then digital health is also security by means what? In a healthcare IT sector, there are different things, right? Cyber security is a part of AI also, but I want to understand what is the difference. You just explain me. What do you mean by healthcare IT sector and digital health?
Technology robotics, like equipments, healthcare robotics and automation.
Yes, but what in which sector you will consider it? The healthcare robotics or any robotics instrument equipment?
In operations, like some robotics.
See, if a robotic surgery equipment, it will comes under medical device and equipment, right? Now, if there is a software for robotics and AI on data and etc., if you consider, then it will comes under healthcare IT, right? And if through this equipment or through this device, if you are connecting with the patient for their healthcare service and all, then it will be a digital health. Got it? Means healthcare IT and tech are dealing with, their business model is B2B. There are IT company who has built hospital management software. They will sell it to hospital and clinic owners. So there is a business to business format, B2B. Where in digital health, what the business model is? Right? There is a platform who is providing telemedicine or online pharmacy, etc. And might be they have onboarded doctors, but their consumers are patients. So B2C business model, right? That way it's a major difference. Even in healthcare technology, you can consider uh, IoT also. Anybody knows IoT? Good, Internet of Things. Now, what you consider or any example in the healthcare? IoT is a tech world, has every equipment or every instrument has some IoT feature. But any of the example where you in healthcare IoT? IoT means Internet of Things. Uh, Maybe you guys have observed nowadays there are smart refrigerator, smart TV, smart ECG machine, smart this, smart that. Except a human, everybody is smart, right? So what happened to that smart ECG, or you can there is a separate keyword for that, mobile cardiac telemetry. So there is a device which you put for the cardiac patient. You need to, yes, have you heard about Holter? Right? Holter records for one particular period, 24, 48 hours of cardiac rhythm need to record it. So nowadays there are devices, you the patient can put it here, go back to home for 48 hours, the device will automatically record the cardiac rhythm. He need not to be there in hospital or clinic, where that rhythm data, cardiac rhythm data will be on the will be on the cloud server of that particular device, and the doctor can refer all the 48 hours of his cardiac graph, etc., and accordingly he can find out what is the diagnosis on. This is IoT, Internet of Things. Any equipment or instrument you thought about it, you can put the internet, you connect with device to the cloud servers and get the data. That's the basic, and it comes under healthcare IT.
Also we come continuous blood glucose monitoring,
Continuous?
blood glucose monitoring.
Yes, that can be. Even any kind of things, any kind of instrument, equipment, you connect it with the internet and cloud servers, that is IoT, basic understanding. And it comes under healthcare IT. And now, see, we come to just halfway. I mean, there are 18 total sectors, so till 9 more is there. But food and beverages, though, I mean, that's separate anyways.
Hospital.
In a hospital, food or kitchen, it's just a F&B industry is one of the sector. That's an F&B industry is separate. We are discussing healthcare industry, that way F&B industry is separate. So again, it's a hospital one service, part of a service. Right? Blood bank, yes, there are blood and tissue bank. Blood and tissue banking. Business format is different. You need a license and there is a separate infrastructure requirement, right? Why tissue banking is there? Any idea? Organ transplantation is different. How? What we understand, or what is your experience on tissue banking? Any example? Anything you know about? Yes, stem cell banking is there. You preserve, right? That's where stem cell is one part of tissue. That is one example. There are many tissue banking things. Placenta, right? So that's another banking. Any example? You guys are MBA, healthcare and hospital management people. You are going to lead tomorrow. You are going to manage in this one of this sector. So your thought process has to be broad, and my aim to is to you have to establish your perspective to a leadership level. You cannot be, you know,
Female ovum.
yes, there are ovum banks or sperm banking, eye banking, any kind of tissues. Even there are skin banking also. Have you heard about it? Burns patient, there are skin banking also. Yeah, fine. I think that blood and tissue banking sector is, you got overall idea, right?
हेल्थ केयर में करियर चूज डॉक्टहब